Tax Act is here anytime you want to easily file your taxes. Tax Act is here for the early birds who like to knock them out as soon as the season opens. And for the procrastinators who like to wait until the very last minute. Tax Act is also here for the middlers who file right in the middle of tax season. No one ever talks about the middlers, but Tax Act sees you, and Tax Act respects you. Tax Act. Let's get them over with.
Atheists, agnostics, long-haired weirdos, short-haired weirdos, vandals, hooligans.
The government, hug the government, love the government, hug the government, love the government, hug the government, love.
Welcome to the Politics Guys. I'm political scientist Michael Baranowski, an emeritus professor at Northern Kentucky University. I'm joined today by Professor of Law at Chase Law School, Ken Katkin. Hey, Ken.
Hey, Michael. It's great to be back.
Yeah, and as always, there was more news than we could fit, or more analysis, I suppose, or punditry, rank punditry that we could fit into 1 hour or so of our weekend show. And there are a bunch of things that we wanted to get to, and we will be doing that right now. And the first one I wanted to talk about is, well, earlier this month, actually, it happened. President Trump announced the launch of TrumpRx.gov. Now, this is a government-branded website that offers cash pay discounts on, at this point, 43 brand name drugs. Ozempic drops from $1,000 a month to as low as $199 on TrumpRx. You got fertility drugs, inhalers, insulin. They're all discounted somewhere between like a third and over 90% off their list prices. But there is a catch. Well, there are a few of them, actually. First of all, TrumpRx doesn't actually sell anything. What it is a portal that gives you, in most cases, a coupon you take to a pharmacy, or in some instances, sends you to a drug maker's own website. Now, no insurance is accepted, which means that for the 84% or so of Americans who have some prescription drug coverage, insurance copays are almost certainly going to be cheaper, at least for covered drugs. Now, the people who are most likely to benefit from this are the 27 million uninsured Americans, as well as people who are looking for prescription drugs their insurance won't cover, especially those GLP-1 weight loss drugs and fertility treatments. Now, the site only includes brand name drugs, which are almost always considerably more expensive than generic alternatives when they're available. For instance, an analysis that was done by Stat News found that of the 23 drugs currently available on TrumpRx, 22 of them are available as generics at considerably lower prices. And so all of this comes not long after the expiration of those enhanced ACA premium subsidies that have raised the cost of plans by an average of $1,000 per person per year. Now, TrumpRx calls itself the most impactful prescription price reset in the history of our country. And President Trump has said it's, in his words, the biggest thing to happen in healthcare in many, many decades that should win us the midterms. Well, most outside analysts don't think it will have anywhere near that impact. In fact, Democrats are calling it a glorified coupon book that's designed to distract Americans from rising insurance prices and coverage losses. Now, I don't think many Americans are going to object to paying less for prescription drugs. That's a winning issue. Even if TrumpRx isn't everything the president says it is, do you think that this is maybe at least a small step in the right direction?
You know, it's a small step in both the right and the wrong directions, I would say. I think the glorified coupon book is accurate. Now, there's nothing wrong with getting a coupon book. And, I was kind of comparing it to whenever I go on, if I use the Microsoft Edge browser and I go on some e-commerce site like Amazon.com or something, start looking for things to purchase, like the Microsoft Edge browser will put up this thing from Bing where it says, oh, don't buy it there. Look, here's another place that has the same thing cheaper. And so I already, I experienced that just, as a part of using the internet. And I think that's what this really is, except it doesn't even necessarily show you all the cheapest prices. And, you were talking about, the comparisons with generics and saying that, generics are typically going to be cheaper than even the discounted prices that are shown on TrumpRx. If somebody was sophisticated enough to know that, they could go to get the generic. But if they're not, then the TrumpRx is going to actually mislead them into spending more than they need to. And there's also other competing private sector sites. Like I think TrumpRx actually stole its name from GoodRx, which it's an existing site that they're kind of trying to emulate. And GoodRx, I think, often, has prices at least as good or better, even on the name brand drugs, than TrumpRx's offerings. I think it's somewhat of a nothing burger, but yet, not harmful. But I think the harm that could be caused, and is a step in the wrong direction, is that it does kind of make it seem to people that there are viable ways of addressing healthcare costs that don't involve getting people healthcare insurance. And I think that's bad. I think like the idea that people are going to be like, oh, if I can actually use a website to find discounts on prescription drugs, then there's less need for me to get health insurance because I don't need the health insurance to cover my prescription drugs. But that's really a very backwards way for people to look at it, because they will need health insurance if they ever, have a significant health event. And getting a discount on a drug you can get at Walgreens, isn't going to make you financially capable of paying without insurance for the healthcare costs that could follow from a significant health event. So I think like it's a harmful kind of misdirection if it's kind of giving people reason to think, well, yeah, maybe I lost my Affordable Care Act subsidies and I don't have health insurance anymore, but I can afford to buy drugs now because I'll get some discount. Ultimately, that's not going to serve people well, and it's going to contribute to a further death spiral in the health insurance markets.
Yeah, I think the strongest argument for this is that it does provide at least some people with meaningful discounts for a number of really popular drugs, including drugs that aren't often covered by insurance and don't have cheaper generic alternatives. And for decades now, presidents have been talking about lowering prescription drug prices. Congress has been deadlocked on this, like on so many other issues. And so Trump was the first one to push back on Big Pharma, the argument goes, by making credible threats of tariffs and also credible threats of slow rolling drug approval for companies that don't play ball with this MFN, most favored nation status for drug prices, essentially, because we know it's also true that for generations, Big Pharma has charged U.S. customers more than in other countries. And so there's something to the case that Americans are, in fact, subsidizing low drug prices in other developed countries. Even if you accept all that, as Republican Senator Bill Cassidy pointed out, he said, well, wait a second, I thought we're conservatives, and doesn't this amount to kind of a version of government price controls? And if you're a conservative, at least an economic conservative, that's kind of anathema to you,
Yeah. I mean, when the Obamacare, when the Affordable Care Act was enacted, one of the big controversies was around whether Medicare, which is a large purchaser of prescription drugs, would be allowed to negotiate for the prices that they would pay pharmaceutical companies for the drugs that the Medicare recipients consumed. And the Republicans were lockstep in opposition to having Medicare be allowed to negotiate the price of prescription drugs. I think, that has fluctuated a little bit. I think in one of the first, I think the Inflation Reduction Act under Biden actually did get Medicare some authority to negotiate prices. But certainly the reason that prices are higher in the United States than in Western European countries with single-payer healthcare systems is that in Western European countries with single-payer healthcare systems, the government can negotiate with the manufacturers about what price they're willing to pay for drugs. So there's just more leverage and more clout there for market negotiations. In this country, we don't have single-payer. We typically haven't allowed the government, even its capacity as the insurer of a fair number of Americans, to negotiate for prices. And all the individual insurance companies can do that, but they're all each representing a relatively smaller part of the market. So I think that's the actual reason that prices have always been higher here than in Western European countries. There's different reasons why prices are higher here than in developing countries. But, in developing countries, if they can't get lower prices, we're just going to be leaving people to die. They're not going to be able to pay the higher prices. So, I think those are again, and that's why I think this is a little misdirection. Like, it certainly will help some individuals, although even for the GLP-1 drug prices that you just quoted, those are the same as on GoodRx. So this is not helping people any more then the GoodRx site would already be helping people. It's not going to actually make it cheaper for any person. If the comparison point is not, what's the rack rate that the manufacturers are listing the list price as, but instead if the comparison is what's the best price people can already get if they research these discount sites themselves. So I think that those are kind of the problems, that it undermines insurance mechanisms, both by, leaving more people believing they can be uninsured and by taking away the clout that insurers would have to push down the prices of drugs if the insurers covered more people. And Medicare's, the number one cover of people, and there's legal constraints that prevent them from negotiating for drug prices.
Eczema is unpredictable, but you can flare less with Ebglyss, a once-monthly treatment for moderate to severe eczema. After an initial 4-month or longer dosing phase, about 4 in 10 people taking Ebglyss achieved itch relief and clear or almost clear skin at 16 weeks. And most of those people maintain skin that's still more clear at 1 year with monthly dosing.
Ebglyss, lebrikizumab LBKZ, a 250 milligram per 2 milliliter injection, is a prescription medicine used to treat adults and children 12 years of age and older who weigh at least 88 pounds or 40 kilograms with moderate to severe eczema, also called atopic dermatitis, that is not well controlled with prescription therapies used on the skin or topicals, or who cannot use topical therapies. Ebglyss can be used with or without topical corticosteroids. Don't use if you're allergic to Ebglyss. Allergic reactions can occur that can be severe. Eye problems can occur. Tell your doctor if you have new or worsening eye problems. You should not receive a live vaccine when treated with Ebglyss. Before starting Ebglyss, tell your doctor if you have a parasitic infection.
Ask your doctor about Ebglyss and visit ebglyss.lilly.com or call 1-800-LILY-RX or 1-800-545-5979.
Yeah, I guess the most positive thing I see potentially from this is it at least kind of gets the government thinking about the idea of being sort of an aggregator, a portal for prescription drugs. And I could see now, but this isn't how you do it if you really wanted a serious service about that. What you do is you list the lowest cost drug, including generics, when they're available for all of these things. And right now, what TrumpRx really is, if you want to be cynical about it, and I'll be cynical about it, it's essentially a DTC, direct-to-consumer. It's a DTC sales acquisition marketing tool for big pharma right now. I mean, it's a portal that's designed to funnel people to these drugs. And so it doesn't have to be that, though. I mean, because the federal government is really kind of uniquely positioned to build a real portal, like a much better one than any place we could find, because the CMS, that's the Center for Medicare and Medicaid Services, they already collect a ton of data on drug prices. And unlike those private companies, GoodRx, RxSaver, Mark Cuban has that Cost Plus thing, they wouldn't have any incentive necessarily to steer consumers to certain drugs or to certain companies. Everything could be based on the lowest cost to the consumer. I could see an argument to be made for a service like that, but TrumpRx isn't that, and it's not surprising why they don't list those generic drugs, because Big Pharma wouldn't go along with that. They'd be saying, well, no, don't steer business away from us. But what Big Pharma really would like to do is they would love to try to eliminate those pharmacy benefit manager middlemen that are huge in this industry. And if they can build up their direct consumer business and cut out that middleman layer, they would love that. And so if you're really cynical about this, you say, well, yeah, of course, the pharmaceutical industry went along with this because it's probably going to be, or it could be potentially, actually a net gain for them. I'm not saying it's going to work out that way, but if you're cynically minded about these things, that's not the most implausible argument in the world.
Right. I mean, if the government really wanted to use the power that it has to bring down the price of prescription drugs, I think there's two really obvious paths for how to do that, but this isn't doing either of them. One would be that the government could use its purchasing power. It could, instead of just giving people coupons, it could buy these drugs, and the government could buy the drugs from the drug manufacturers at rates that are negotiated and that are low. And then the government could, resell the drugs to individuals without making a profit on it. That would bring prices down. Or another way they could do it is just by actually legislating price controls. That would bring prices down. But this isn't going to do any of that. The other thing I was going to say, one thing you mentioned, I almost let it go by without comment, but this idea of a most favored nations thing for drug companies that is going to involve, like, if you don't stay in the good graces of the government, we're going to slowball your drug approvals. Besides being extortionate and being in violation of the standards that are in the Food, Drug, and Cosmetic act for what does a company have to demonstrate to get a new drug approved? Well, it should only be that the drug is safe and that it's effective for a particular use. There's no element of cost there in terms of the drug approval criteria in the Food, Drug, and Cosmetic Act. But also, it somewhat provides a cover for the kind of craziness of the RFK Department of Health and Human Services. And, just this week we saw them actually blocking, an effective new flu vaccine. And I'll say, as someone who was vaccinated in the fall and who got a terrible case of the flu in December after being vaccinated, this year's flu vaccine barely works. It's the most ineffective one in a long time. And Moderna had just come up with a newer one, but because it was mRNA based and JFK has some kind of crazed phobia about mRNA-based drugs, he disapproved it for that reason. But this would give him a cover and say, I'm disapproving it because Moderna's not on Trump's most favored nation or whatever. So I think that also could have a lot of serious harms to the public health.
We hope you enjoyed this preview of our supporters-exclusive midweek show. If you'd like to hear the rest of the episode, we hope you'll consider becoming a supporter. Supporters get ad-free access to all of our shows, membership in our Politics Guys Discord group where you can join in on the conversation, and other benefits at different levels of support. To become a supporter, go to patreon.com/politicsguys. You can also support us through Venmo or @politicsguys or through PayPal. You'll find all of our support links in the show notes as well as at politicsguys.com/support. And if you'd like to get the midweek show, but you're not in a position to become a financial supporter, that's not a problem. Just send me an email at mike@politicsguys.com, and I'll be happy to get that set up for you.
This podcast is part of the Democracy Group,